All right, guys, I'm ready. Well, cosmetic procedures have always been controversial, but one type of procedure is gaining widespread popularity. We're talking about Botox injections, and Mallory Krispinsky and Amy Volkmann from Paris Dermatology are here to tell us about Xeomin, a pure form of Botox that helps diminish the appearance of facial lines and wrinkles. How are you both?
Good. How are you?
I'm great. Thank you for being here. So I know a lot of people are scared to get Botox or Xeomin because the drug in the name is toxin. They're scared of that. So what can you tell people about that so they're not scared?
So we've actually been injecting neurotoxins for almost 30 years for cosmetic procedures, and they're used now in many other procedures in much higher quantities. So there's a lot of research and data to show that they are safe.
Okay, all right. And how would you say Xeomin is different from Botox?
So in the lab, Botox has some proteins around it and Xeomin doesn't, so it's kind of known as naked Botox. But whenever they're injected into the skin, they do the same thing to the muscles.
Interesting. All right, so they're both safe, which is good, and I prefer Xeomin because it's the pure form of it. So who is it for? Who should consider getting this, and why, and at what age?
So really, anyone who doesn't like their lines or wrinkles is a candidate. We see patients as young as their 20s for the injections. That would be more prevention, and then all the way up into the 80s who are doing it to diminish the deeper lines and wrinkles. And we do inject both men and women.
Men get it too?
Yes.
Okay, so this is something that really is gaining popularity, huh?
Yes.
Okay, and so where can it be injected on the face?
So a lot of times we think of it for the upper face, so people get it done to their forehead, the 11s that are between the eyebrows and the crow's feet. We can also do other areas of the face, which we would talk about whenever you're in the office.
Now, what about the frozen look? I know a lot of people don't want to get Botox or Xeomin because they're scared they're not going to be able to express themselves, move their eyebrows. What would you say about that?
That is not the look that we're going for. We don't want that look. We just want you to look softened so that when you raise your eyebrows, I have it done so my eyebrows go up and I'm just not getting the lines up there. When I smile, I'm just not getting the lines to my crow's feet. So that's all it is just softening those lines.
You know, it's funny, I told my parents about this and they said, what? You're getting what done? Isn't that permanent?
It is not permanent. On average, it lasts 3 to 6 months. My happiest patients are coming in about every 4 months when it's about 60% worn off, just to keep those muscles from contracting and those lines from coming back.
So when you get it, like when I get it today, when will I start to notice some results?
About 2 weeks from now is when you'll see the full results.
Okay, and then people always ask, does it hurt?
It is a needle stick, but it's a teeny tiny needle stick. It is really not that bad. Usually when I'm done injecting people, they look at me and go, that was it? Because they were expecting a lot worse.
Interesting, but it's a bunch of little pricks, right?
It depends on where you're doing. So the 11s usually take 5 sticks, the forehead anywhere from 3 sticks to 10 sticks, and the crow's feet 3 to 4 sticks per side. But the needle is itty bitty. It's a little insulin needle and it's not bad.
And then you always see the risks. I know on TV it says you could get this, this, this. I know the pharmaceutical companies have to say that by law, but I mean, is it really that risky for on your face?
I've never had, knock on wood, anybody have any problems with it. It is needle sticks. You can always get bruising, bleeding, infections at the injection sites, but we keep it clean, we keep it sterile. And like Amy was saying earlier, we do it for other procedures at much higher quantities.
Okay, let's see some before and after pictures there. And so you can see some before and afters. Wow, look at that. Those are the 11s.
Those are the 11 lines there, yep. So the person is just contracting, and when they contract, they're not getting those lines there anymore.
Oh, that's amazing. I mean, that's a huge difference there. And how long would it take to see results like that, do you think?
So after it's done, you start to see results about in a week's time, but you see the full results at 2 weeks. And like I said, about 4 months, you're about 60% coming back, and that's when you're coming in for more injections.
All right, let's do this, guys.
All right.
Let's do it. So what are we going to do today? We're going to do the glabella, right?
Your 11s.
Okay.
So the way we do it is, like I said, we keep it sterile, so put our gloves on, wipe you down with a little bit of alcohol, and then it's 5 itty bitty, teeny tiny needle sticks to the area.
Okay, perfect. So I'm ready for this. Where's the alcohol? There we go. All
Gotta
right,
keep
Amy.
this clean.
So clean me up here.
All
All right, you're not nervous, are you, Mallory?
No.
Okay, good. We want to make sure that nothing.
I do this all day long.
You do.
Okay.
Are
Are you ready?
Let's do it.
Okay, so first I'm gonna have you scrunch in. So frown. Okay, so go ahead and relax. So I'm gonna do the first injection, 1, 2, 3, ow. Perfect. Go ahead and scrunch in again. 1, 2, 3, ow. Go ahead and scrunch in, ow. So I'm having you scrunch in so I can see your muscle anatomy. Scrunch in one last time, And just relax. Ow. And last little needle stick. Perfect. You did amazing. How'd it feel?
I did it. That wasn't bad.
Good.
That wasn't bad at all.
Good for you.
Well, guys, thank you so much. Where can people get more information if they want to look into this or any of the other products?
So you can go onto our website at parasurdermatology.com. We have multiple locations around the Hampton Roads area. We do cosmetic dermatology. We also do medical dermatology, so total skin examination, skin cancer, all of it.
Thank you so much. It wasn't bad at all, guys. More Coast Live after this.